Hello, everybody. I am Maria, and I'm the admin of the Money Making Esthetician Facebook group. And today I am so excited. I'm joined with Mona and Ben, and they have a wealth of knowledge. One of the reasons I really wanted to bring in this peel is one, it is peel season. Even though BioRePeel, you can do it all time around. Sometimes we like to do it in the winter. So I thought this is a perfect time to make sure that we're really set up for success. So we really want to open the floor. One of the mottos for the Money Making Esthetician Facebook group is don't suffer in silence. So we all came together because we really want to make sure that you're taking advantage of the true benefits of BioRePeel. If you're not familiar with BioRePeel Gold and some of the mesotherapies, so how we're going to be successful is if you are having trouble with BioRePeel, we all came together so that we're able to troubleshoot and kind of really figure out what you guys are struggling with. So please don't be shy. We really hope we have made this space comfortable enough for you to be able to ask questions. Because if you ask questions, that's how you're going to be successful with the peel. Mona is going to be working through some of the ingredients and the technology of BioRePeel. And Ben is also going to be helping us with marketing on how you're going to get new clients in the door and how you're going to be able to present this. So for those of you who are thinking about getting BioRePeel and just don't know how to start marketing it, Ben and Mona are here to help us.
Awesome. Well, thank you so much, Maria. Hi, everyone. My name is Mona Cardozo. I'm the VP of Sales and Education here at BioSkin Aesthetics. I'm so happy to be with you all today to go over what BioRePeel is, how it works, how we can get it on the menu and on our clients in the treatment room as well. Just a little house rules. If you do have any questions, please don't hesitate to ask. At the very bottom of the screen, there is a little chat. You can definitely type in your questions there, or there is a hand raise. And you can definitely raise your hand if you want to come on mic and ask the question. We are always here to support you, so please don't hesitate. And I'm going to pass the mic over to Benjamin.
Great. Hi, everybody. Very nice to meet you. I've been with BioSkin for a while. My background predominantly is marketing and advertising. But again, listen, what we're doing is we are treating our hyper local area. So I have a lot of background in doing something like that. I want to make it very clear. This is for everybody. You can all take part in this. It takes a little bit of effort on your end. Okay. So listen, forget everything that you think you know about trying to reach new people. This is a referral-based business. Okay. So your relationships are going to go as far as you let them, and you can take it as far as you want. Okay. So a couple of things to just keep in mind. Again, we're going to get into the actual aspects of what makes BioRePeel so great, what makes serum mesotherapy so useful, and how to use Lucente, specifically targeting melasma and pigmentation. At the end of the day, it doesn't necessarily matter about what products you're using. I think we can all agree that it is the hands that are using these products, that are applying it, that are actually meeting these people that are coming in. Okay. Some people really want treatment from you. They're going to look at you like you're the fix, you're the answer to all their problems. That is not the case. Okay. We always want to do two very important things. We promise, and we always want to over deliver. Most important things to do. So forget about the products that you're using for a second. Just think about, what can I offer to my customers that is value? What is value? You guys are the value. Okay. Whenever you're making posts, whenever you're on social media, and by the way, being on social media today, I hate to say it, it's just a must have. It's not a nice to have, it's a must have. If you don't have a website, figure it out. If you're not using Instagram, figure it out. Listen, it doesn't matter how inept you are with technology. It doesn't matter how much you know. Just break it down into little bite-sized pieces. Okay. So what we want to do is we want to have a presence, whatever it might be, whether it's through the local community, whether we're talking to, the local clubs that we're involved with. It's all relationship. This is a relationship-based business. Okay. So people are gonna come see you, not necessarily because of the amazing products that you have that you guys are gonna get from us. They're gonna come see you because they like you. Your vibe is there. The atmosphere that you create is there. Okay. The way that you express your passion towards helping other people is there. That is the most important thing. Okay. So if we can all agree on that, fantastic. Please, there's probably going to be a ton of questions on, how do I get set up with this? What do I do with that? Listen, brand building is very simple. You need a brand. What is your brand? Your brand could be your name. Your brand could be a logo, whatever it might be. Always bridge it back to the fact that you are a human being and we base our lives around human connection. Okay. That's marketing 101. That's the first thing that anybody's going to teach you, how to build a relationship. How do you build a relationship? Well, you can essentially, go throughout life and you can kind of take into account all that's happening around you, or you can just keep the blinders on and you can just focus on one particular thing. Either way, be the best version of yourself in front of your customers. Let people know that you've got these fantastic products, that you want to help them. Okay. That's just branding 101. You are the brand. So please continue doing what you're doing. If you have questions about building a brand, by all means, Maria has my contact. Mona is an expert. Alexia has been doing this for a long time. She understands, how to build a brand. Ask any one of us at any given time. Okay. We are all friends. We share information. We share whatever it is that we need to make sure you're successful. Okay. That's my opening statement. Mona, should I keep going?
I love that. Well, I'm
All
just
right.
gonna allow Alexia to introduce herself and then we can jump right in.
Perfect. Thank you. I'm Alexia. I'm just here to support the team today at Bioskin Aesthetics, and I'll just be answering any questions. So if you guys do have questions and you're shy to come on the mic and ask your question, just throw it in the chat and I'll give you guys a response. And if it's something that I think the whole group should be aware of, then I'll just let Mona and Ben know and they can address it live. Thank you.
Awesome. Thank you so much. So let's get started. What is BioRePeel? Where did it come from? How do we use it? And what's the difference between the formulas? So BioRePeel was developed in Italy by CMed Aesthetics. We are actually in 86 countries worldwide, which is amazing. We do have two different strengths of peels. So my first peel is my blue, and that is right here. I don't know if you can see my screen. But essentially, BioRePeel Blue is a 30% TCA, modulated TCA, so it's not straight acid, which is great. Nothing on it, nothing on the market like it. It has a patented biphasic technology, which I will get into a little later. But BioRePeel Blue is used for the face, the neck, the décolleté. This formula is safe during the summer, it's safe during the winter. So with BioRePeel, you no longer have a peel season, and that is what's so remarkable about BioRePeel. You don't have to put it away when the sun is shining. You can literally offer this 12 months out of the year, and you can generate revenue with our products. Now, BioRePeel is safe for all Fitzpatrick, skin types 1 through 6. You don't have to worry about your 4s, 5s, and 6. We don't need to prep their skin weeks in advance. So this is a perfect even lunchtime peel. So you can have someone walking through your doors, as long as they go through those contraindications and we pass all of that, they can actually have a BioRePeel done right then and there. It is suitable for acne, rosacea, melasma, pigmentation, wrinkles, lines, resurfacing, texture, scarring, the list goes on. It is so powerful, and this is all due to its formula and technology. With BioRePeel Blue, you can actually offer it as a standalone treatment. So just cleanse the skin, apply the peel, let the timer go, remove the peel, and go in with your hydration and SPF. Or you can actually mix it in with some other modalities that you may have. Those modalities I will get into more depth, but it could be like dermaplaning, hydrofacial, microneedling, microchanneling. There are so many other treatments that can be incorporated with BioRePeel, and that's where you can really build a combination treatment for your clients. Now with BioRePeel Blue, we do have a BioRePeel Gold. This BioRePeel Gold is our 50% TCA. Now BioRePeel Gold is generally for the body, so your shoulders, your hands, your feet, your stomach, your legs, your back. But in some advanced protocol, you can actually use the gold on the face for spot treatment. So if your clinic does not, if you don't offer, your spa doesn't offer body treatments, you can still use my gold on the face for spot treatments to make BioRePeel Blue a little bit more advanced. Now the same goes with BioRePeel Gold. It's summer safe, it's winter safe. You can use BioRePeel Blue and Gold all year round. You can use it on all Fitzpatrick skin types 1 through 6. And BioRePeel Gold, just like BioRePeel Blue, is super, super versatile. Use it on its own on the back of the hands, for example, or mix it in with some other treatments as well. So you can definitely get a lot with the BioRePeel. You can really mix it up and really create custom packages for the client. I think that's what's really important about BioRePeel is that yes, you can do the exact same treatment on every single client that walks in through those doors, or you can modify each treatment based on the client's needs. And that's what's so unique about BioRePeel. Now you might be asking, how is this all possible? How can we do a 30% or a 50% modulated TCA peel all year round? We can offer it on all Fitzpatrick's. We can do it on so many different skin conditions and mix it in with other modalities. The answer to that is that BioRePeel has a biphasic technology. And essentially what that means is that there's 2 layers to our formula. When you look at a vial of BioRePeel, you actually see, it's hard to see on camera, but there's a little blue layer. Let me just show this. Well, it's hard to see on here as well, but there's a little blue layer and a yellow layer to our formula. That basically means that there's 2 layers, and each of those layers have specific actions on the skin. So the top blue layer is your lipophilic phase. Essentially what this does, it films the skin. So traditional chemical peels, once you apply it to the outer skin, you are going to experience some epidermal water loss. With BioRePeel, we don't experience any of that. We actually take the peel, all of the ingredients, there's a carrying ingredient that pulls everything right down into the skin, working from inside towards the outside. It also has a filming action where it films the skin so we don't experience that water loss, but it also boosts hydration. So essentially with BioRePeel, the difference between a BioRePeel treatment chemical peel versus a traditional chemical peel is that we work from inside towards the outside rather than working from the outside of the skin, causing that injury to that skin barrier and then leading it to being a peeling peel. With BioRePeel, it also has a protective ingredient that protects all of the ingredients from oxidizing. So the moment that you puncture it, you can actually let this sit on your shelf, just like I have behind me, for about 8 weeks. And if it's not punctured, each vial does have an expiry date. So what that means is that it's not temperature controlled. You don't have to put it into the refrigerator the moment that you puncture it. We don't have to ship on ice, which is great. Now the bottom layer, that is your hydrophilic phase. This is the powerhouse to our peel. This is where you're going to find all of those very strong ingredients like your TCA, AHAs, PHAs, amino acids, vitamins, and gamma. Now you all might be thinking, well, all I see online is this green peel, green peel, green peel. Where is that green? So when you take BioRePeel and you shake it to activate it, because that's the first step before any application, you are going to see that the formula turns green, just like that. Now, when the formula is green, it's ready for you to puncture, draw up, and place on the skin. Now, we really want to shake and activate the peel the moment we're ready to use it. So don't do this before the client comes in, before you prep the skin, before you cleanse the skin. Really do this the moment you're ready to apply the peel. You don't want to do it ahead of time because that lipophilic phase and hydrophilic phase, one is an oil layer, the other is a water layer. They're actually not combining. What's happening in this vial is an overlap. So the blue layer is overlapping with the yellow layer, creating that green color, but within a few moments, that is going to do a separation. Blue is going to rise to the top and that yellow is going to stay right at the bottom. So before every application, you want to shake the vial, activate it, and place it on the skin. Now you might be asking, what does BioRePeel feel like during? What happens to the skin post? So during application BioRePeel, there's a very, very minimal pain involved. I'm going to use myself as an example. I am super sensitive. You touch me, I turn red. When I do a BioRePeel treatment standalone, I feel it about 2 out of 10. And being extremely spicy. When I do a microneedling with BioRePeel, I feel it about a 5 or a 6 out of 10. If I'm doing, let's say, a dermaplane before and then I apply BioRePeel, I'm feeling it 4 to 5 out of 10. So there is some tingle, some sensation, but it's not over the top where you have to put ice on the face because it's on fire. Now, what happens post-peel? Now, BioRePeel does have very, very minimal downtime. You aren't going to experience sheet peeling with like a TCA chemical peel of its strength, only because of the formula. Remember, BioRePeel doesn't cause any injury to that outer skin. Everything is happening beneath the skin. Now, with BioRePeel, slight flaking is completely normal. This is really based on clients' skin barrier. The more compromised the skin barrier is, the more flaking you're going to see. Now, on a scale of 1 to 10, generally flaking at the most advanced modality is going to be around a 3 or a 4 out of 10. 10 out of 10 is sheet peeling. So some of your clients are going to experience minimal flaking and some of your clients won't experience anything. But that doesn't mean that BioRePeel is not working. So It's very important to let the client know how BioRePeel works because of its technology and what it is doing in our skin. So essentially, BioRePeel does stimulate fibroblast activity, it protects against free radicals, it builds collagen production and elastin. So the moment you remove BioRePeel off the skin feels like velvet. It's so soft, it's so radiant, it feels really good. But as the days go on, those results are going to get better and better and better. Now I'm going to give the mic over to Benjamin to just go over cost and how we can sell it on the menu, and then we go hop back on what we can pair it with.
Sure. Okay, great. So thank you, Mona. That was awesome. Great overview. I always like to pause between pivoting. If you guys do have any questions kind of about the tech and how the particular product works, just drop it into the chat and we'll try to answer your questions. I'm going to go through some basic cost analysis, okay? Very, very simple. Listen, if you're a business owner, you have overhead. If you're a solo esthetician, you still have overhead. It's just not as much as, say, if you were running a med spa. So for those of you who run med spas, you're going to get this pretty quick. For those of you who are solo estheticians, it is very, very simple to calculate. And if you do need any help to understand what your cost per treatment is, please reach out. We will break it down for you. Everybody's going to be a little bit different, okay? I'm going to give you some general costs and some general numbers to work with, okay? Typically, for giving a face treatment with BioRePeel Blue, you're typically using 2 ml, okay? So here's your first number coming up. It's $33 for your 2 ml face treatment. That's not including any consumables. That's not including your aftercare. That is very much recommended to provide to your customers for their at-home, in-between treatment care, okay? Even though this peel does an amazing job at hydrating the outermost layers of the skin, and what's going on underneath the skin is really where the magic happens. You need that cellular turnover at least 3 times minimum, okay? We'll get into protocol in a minute, but right now I just want to focus on one face treatment, 2 ml, $33, okay? So let's add in some aftercare that we know we're going to be giving our customers. We don't necessarily want to add this as a separate cost. We want to build it in to our own cost, right? As far as your customers are concerned, this is thank you. This is, hey, listen, there's going to be a little bit of peeling and flaking. And if not, great. There's going to be a couple of things going on. Okay. You're going to have a little bit of redness, but you're going to glow. So let's just take into account this aftercare that we're going to be providing to our customers. That's essential. Okay. So again, just for argument's sake, we're going to add in $8 to $10. Okay. On the conservative side, let's just say an additional $10. Now, this still doesn't include your nitrile gloves, doesn't include your tips and cannulas or your cannulas and syringes. This doesn't include any sort of products that you're going to be doing because pre-peel, you're focusing on cleansing and exfoliating. Post-peel, you're focusing on hydrating and nourishing. So that said, let's just start to visualize what it's going to be for our cost per treatment. I think $45, okay, USD, okay, I think that's a realistic number. For the Canadians in the room, okay, we're at 65 bucks. $65 Canadian, $45 American. I think that is a good conservative number to start with. Now, what you need to do and what you need to ask yourself is, how much do I want to make off each peel? Do I want to make 50 bucks? Do I want to make 150 bucks? Do I want to make 250 bucks? I can always tell you that in volume, you will always make more. Selling series of peels will always yield much higher return on investment than just doing one-off peels, but that shouldn't be discounted. Okay, I'm going to pause there for a second. I'm going to bring you back in. So we've got a cost per treatment for a face treatment. That's 2 ml of BioRePeel Blue. Okay, we're saying conservatively $45 USD, $65 CAD. Okay, now what we're going to do is, if you're just starting out, ladies and gents, here's the thing. You have to have a launch phase. If you've got a great clientele and there is absolutely no doubt in your mind that if you put this on your menu, people are going to find it themselves, great. But typically what's going to happen is you're going to have to launch this. This is brand new. Okay, so if you're adding this to your menu, for those who have not used this product yet, there's a bit of a learning curve. There's a learning curve for the way that you're going to visualize this product. You have to speak in your own terms. You're not going to talk like me. You're not going to talk like Mona. Okay. What you're going to do is you're going to figure out what you're going to say to your customers so that when they're in the chair, now is the time to discuss, hey, by the way, have you tried this new treatment? I'm having a special on it. Okay. Or I'm offering some promotional purposes, and make them feel special for the first 4 to 6 to 8 weeks. Okay. And by no means am I telling you how to run your business, but for the first 4 to 6 to 8 weeks, any new platform, any new program, any new treatment that you want to launch, have some sort of an incentive. Build off that. Let everybody in the community know whatever you need to do. Listen, I tell all of my professionals, if they are in small towns, I love that because they have very little competition. And all they have to do is go to the local coffee shop, go to the local baseball game, go to the local football game, hang out, show up, talk to the moms, talk to your friends. Word of mouth is by far the best way that this news travels. Okay. Forget about this marketing, digital stuff. Forget about it. Talk to your friends, talk to your people, offer incentives. Okay. So for the first 6 to 8 weeks, what are you going to offer this for? This is why I say it's so important for you to figure out what you want to make. Okay. And what is important to you. If you're just building, you're willing to take a little bit less profit so that you have more people coming in, doing these peels, understanding what they are. And I promise you, 9 out of 10 people that do at least 3 peels and see the results are happy customers. Okay. I've got stats to back it up. I'm not going to bore you with them, but I promise you, a session of 3, next level. It's really going to change the way that the skin looks, feels, the way they associate themselves with other people. This is what comes, and who is responsible for this wonderful transition? Every single one of you. That's why it's important to understand. You're not necessarily selling products to people. You're selling yourself. You're the brand. You're the face. You're the hands. Okay. BioRePeel in the hands of me is going to be very different in the hands of Mona, going to be very different in the hands of every single one of you. Okay. We all have our own way of doing things, our own way of assessing things. So reining you back in, $33 bare bones, 2 ml of product. Okay. Let's incorporate a little bit of aftercare. Let's incorporate some of our consumables. And there is your cost per treatment. First launch, let's not necessarily blow it out of the water unless you can. We like to keep a baseline of $250 cost per treatment. But ladies and gents, that is relative to the community you cater to. That is relative to the demographic that you are treating. Okay. It all depends on your environment. So please, please understand who your audience is. And if you have any questions about how to figure this stuff out, I am here to help you. Mona is here to help you. Maria is here to help you. Alexia is here to help you. Okay. So getting into gold, okay, it's a little bit of a different play because you're using the gold typically tuned for the body. And as Mona said, you're going to be using it for spot treatments on the face. It's a wonderful stack. Okay. I will let Mona talk about the protocol, but let's just talk about the cost per treatment specifically for 1 ml, 1 milliliter of gold. Okay. You're typically sitting anywhere between $15.25 to about $16.20. Okay. USD. Okay. For the Canadians in the room, it's 21 bucks. Keep it at that, right? Very simple. Okay. So if we're going to be doing a combination treatment, and again, based on your state regulations, if it's under your scope and you can use our BioRePeel Gold, please consider incorporating that. What you're going to do is essentially provide more value to your customer. Okay. So what did I talk about? I talked about your $33 cost per treatment for 2 ml of BioRePeel Blue, which is our superficial peel for the face, neck, and décolleté. If you're adding in gold, charge per ml. Same situation, anywhere between $15.25 to $16.20, your cost per treatment. Again, you're taking into account if you're using any consumables. And again, what you're going to do is you're going to bundle this up. What you have to do is figure out how much you want to make off each ml of product that you use. Okay. I can definitely get into our serum mesotherapy or our Lucente. I want to pause there for a second. I want to see if there's some questions. And I definitely want to let Mona chime in.
Yeah, absolutely. So at this point, is there any questions in terms of cost, marketing, even like the technology and how it works? Not yet protocol. We'll definitely get into protocol because that's a whole other chapter. But just on everything that we discussed right now, for those that are offering BioRePeel, what are you charging BioRePeel on your menu? What are you doing it as a series? Are you doing it as a standalone? And for those that are not yet offering BioRePeel on your menu, if you can just chime in or let us know in the chat area, what peels do you currently offer and how much do you currently charge for those peels? So I will allow anyone answer. Perfect. So we have someone charging BioRePeel as a standalone for $200, which is great. We have $325 per treatment out in Texas. So that's really important. It really depends on where you're located. I have clinics in California that are charging $6.99 a treatment. Then we have, someone in Texas doing $325 a single application. Then I don't know where you're located, but then we have someone doing $200 a standalone. So it's really important to keep that in mind as well on your location. And we really want to add BioRePeel right to your menu so that it fits seamlessly with all of your other treatments as well. BioRePeel does have a very low cost per treatment, meaning your ROI is extremely high with BioRePeel. So that really does play a role on how much you can charge. So we have someone out in Scottsdale doing $250 a single application. We have a series of 4 for $280. If my math is correct, that's about $240-ish per treatment. So really that's a great ballpark to begin with BioRePeel. We always like to say start at $299 for a single application. And then if someone buys a series of 4, because you really want to encourage BioRePeel to be done in a series, and these series are done every 7 to 10 days apart. So it's not like you have to wait 3 months to do another treatment, 6 weeks to do another treatment. You can really catch that client and finish their entire series within 2 months and see those incredible results. So we always say start at $299 for a single application, but to get the client more excited, to get the client to actually purchase a series, we like to say give them a little bit of a discount. So maybe you can say $299 one application, but if you buy 4 upfront, we can do 4 for, what was it, $980? You said over here, $980. And then you can also say you get a cream and a serum in that package as well, or you get a dermaplane with your treatment, or you get LED therapy with your treatments. So throwing those little extras will really help sell packages rather than doing just individual treatments, because who doesn't want to save money? Who doesn't want to get free stuff? We all do. We all love it. So that's definitely a great marketing tactic that you can definitely use. Again, with your cost being so minimal, your ROI is extremely high. So just to take into consideration, let's say that you are giving a cream and a serum complimentary to that package. We're adding $30 times 2 because each of these costs $30. So that's $60. If you're doing $33 for your full 2 mLs and you're doing 4 treatments for your client, that's 33 times 4, 132 plus 60, you're at 192. Right? You're charging $908, your profit margin's upwards of $800, which is great. Now you can consider, your LED therapies, your dermaplaning, and anything else that you may want to add into this package. So please keep that in mind. Your cost per treatment is extremely low, but super effective, right? BioRePeel is super, super effective, patented technology, nothing else like it on the market. And then you have your ROI, which is extremely high. So that's really nice to see all the different prices that are taking place on the menu. Let's see here. Sorry, I can't read all of these questions. So
Well, there's
how much
just
should we charge? Oh, sorry, go ahead, Maria, or who was that? I don't know who that
Alexia.
was. Oh, hi.
Maybe if you can just go over one question that did come up.
Yes.
The gold spot treating with
Uh-huh.
the microneedling. Can you do all of those?
So that's a great question. I'm gonna get into protocol in just a few moments. I just want to answer this one question about pricing. So how much should we charge for gold per ml? So that's a great question. You know that your cost per ml is around $16.25 or $16.50. Let's just go all the way up to $20, let's say. We always say charge per ml, $100. So if I came to you and I did the back of my hands and you use 2 ml, you're gonna do 100 times 2. That's how much I pay at the front desk. It's costing you $16.25 times 2. If I did my back, let's say your next client is doing their back and they used 4 ml on their back, you're gonna do 100 times 4. So essentially you're setting a per ml price and you're timesing that by the amount that you're using. The reason why we say this is because the body is so large, there's so many different areas that need to be covered. If you're setting an arm price and I come in and I need, let's say 6 ml on my arms, and then you have Alexia that's much smaller than me that comes in and needs only 3 ml, are you gonna lose money? Are you gonna charge me more? Are you gonna charge Alexia less? So to always have the accurate pricing with BioRePeel Gold, do per ml, and that can happen during your consultation. But when it comes to the face, we're always gonna keep it the same price, no matter if we are, doing that full 2 ml, or if we're doing a little bit more for the face for a little bit of spot treating. I personally like to tell my clients, if you're spot treating with the gold, have that incorporated onto the face price. But then we have, some clients that charge extra for the gold being spot treated on the face. Sorry if that was a little that was a little tongue twister. But when it comes to the body with the gold, always charge per ml times the amount used. When it comes to the face, it all depends. So we can have a little different conversation on that if you are going to upcharge or not. Any other questions about pricing? Sorry, I'm not looking at this, Maria or Benjamin or Alexia.
I
The main
think-
question are protocols.
Yeah,
Let's
lots
get
of
into them.
questions.
Yes, so we're gonna start off very, very simple, very, very easy. Yes, Maria?
And we do it as a standalone treatment. And do you
Yes,
get
so I'm gonna start right at the basics. The reason why I'm gonna start at the basics is because anytime you do BioRePeel, if it's your first time with your client, or if it's the first time you're doing it on yourself, if it's the first time for anyone, you're always gonna start with BioRePeel Blue as a standalone. I don't want you mixing microneedling with it. I don't want you to do dermaplaning with it. I don't want you to do anything else, but really introduce BioRePeel solo to the skin. The reason for that is that we want to introduce it to the skin, see how the skin does, and then we like to work our way up. I don't want you to do everything all at once and then there's a reaction. We don't know if that's from the gold, is that from microneedling, is that from dermaplaning, is that from BioRePeel? So we really want to help ourselves for any troubleshooting by starting off BioRePeel very slow and working our way up.
My buns aren't good enough for you?
Sorry, I think, there we go. And work our way up. So because you're selling BioRePeel in a series, this is why it's so fantastic to start slow and then next treatment add something different, and then the treatment after that add something different, always having a new combination treatment for your clients. But if you want to do BioRePeel on its own by cleansing the skin, we're always going to cleanse the skin, remove any makeup, sunscreen, or lotion. And then from there, we are going to go in with a degreaser. Now, some people do use alcohol to degrease and others do not. That is okay. So for example, I'm going to use myself as an example. I cannot put alcohol on my skin prior to a BioRePeel treatment. As long as the skin is clean, double cleanse, there's no more makeup on it, you can go in with a BioRePeel treatment solo. Other clients do use witch hazel. There are a list of different ingredients, or sorry, products that you can use to degrease the skin, and we can get into that a little later. But essentially you want to cleanse the skin, remove anything off that surface, go in with your degreaser, then you're going to go in with your BioRePeel. This is the moment where you're going to take your bio and you're going to shake it back and forth to activate it, making sure it's nice and green. From here, you're going to take your syringe and cannula, you're going to puncture the top, just like that, and then you're going to begin to draw up the product. Now you're going to go to the number 2, that's 2 ml. Once you've done that, oop, it's stuck. Always wearing gloves. You're going to divide the face into 3 different areas. 1, 2, and 3. You're going to take BioRePeel, you're going to place it onto the skin, and right away, you're going to massage it into the skin. The reason why we're massaging it is we're helping that carrying ingredient pull everything right down into the skin. Now, you do see online these little dots, and they're great. It's a great, great, great marketing, advertising tool that you can use, but it's not mandatory. I always like to say on your first few applications of BioRePeel, do a straight line, do a big circle, just to make sure that the peel is on the skin and you're massaging it in right away. If we are doing these little dots and we're taking a very long time to do the entire application, Remember, BioRePeel has a caring ingredient. It's gonna start pulling everything down in those little dots that you have placed onto the forehead, and the surrounding area is gonna get no peel. So to avoid all of that, please put the peel on, and within, I would say 5 to 10 seconds, massage that peel right in. So what that's gonna look like is peel, begin to massage, always wearing gloves. And once the peel gets sticky and tacky, and you'll notice it because your gloves are really gonna stick to that skin, you stop massaging, you move to the next section. Massaging generally takes maximum 45 seconds. If you're finding yourself massaging longer than that, you're massaging too long, you're now causing friction on the skin. Move to the next section. So I always like to massage, do a little test, making sure it's tacky. Once it's tacky, hands off, next section, apply the peel, massage, do a little test. Once it's tacky, next section. And I will continue. Now, BioRePeel is safe right around the eyes, right around that crow's feet. Some like to do it right around underneath the brow bone. I don't like to go to the eyelids, not necessary. Under the brow bone, again, it's not for every single client, it's client to client based. But with BioRePeel, you can take it there. When you get around the lips, I always like to say roll in the lips and really get this area. The chin is definitely a great area for like uneven texture. BioRePeel is great everywhere. Now, once that last section is completely sticky and tacky, your timer starts. Your timer starts for 5 minutes to 7 minutes. I always like to say first-time clients that have never had a chemical peel done before, 5 minutes is your go-to. Someone that you know has been coming to you for years, you know their skin, it's resilient, it's gone through everything with you, chemical peels, microneedling, you name it, they can go for a full 7 minutes. Any time in between that is absolutely okay. BioRePeel is self-neutralizing, meaning it's gonna stop to work on its own. So all you have to do when that timer is up, you have to take water, cool water preferably, and remove everything off the skin. You really wanna make sure everything is removed. So do like, 2 wipes, 3 wipes, look at your gauze, making sure that greenish yellow color is no longer left. And then from there, you go into your post-care. So you're gonna start off with BioRehydra, which is your serum, 1 pump. A little goes a very long way with the stuff. Then massage that in, and then you're gonna go with 1 pump of Relift, massage this in, and then SPF, and you're done. So that is your topical application with BioRePeel. That protocol should take you no longer than 25 minutes. From cleansing to SPF. Now, just to recap, cleanse the skin, mandatory. Go in with your degreaser. From there, you're gonna shake your bottle of BioRePeel, draw up 2 ml, place it on the skin, massage until sticky and tacky, move to the next section. Place, massage, sticky and tacky, move to that next section. Place, massage, sticky and tacky, set a timer. So timer starts the moment you're done that last area. Once the timer is up, 4x4s, sponge, or a towel that's wet with water and water only, remove the peel off the skin, and then you go in with your post care and SPF. That's it. So now we're gonna do, let's say, a little dermaplane. So everything stays exactly the same. The only thing that you're gonna do now is after cleansing, you're gonna dermaplane. Remember, this is not gonna be on client's first treatment. Maybe when they return a week's time, you now introduce a dermaplane. So everything stays the same. You're gonna cleanse, do your dermaplane. If you use oil to dermaplane, oil needs to be cleaned off before the application of BioRePeel. Once you're done your dermaplane, you're then gonna shake your vial, you're gonna puncture the top, and you're gonna begin that same application, set a timer, and remove. Let's say you wanna do our Forever Kit. So if you don't have the Forever Kit, this stuff is great. It's great on the face, it's great on the body. It comes with 3 items. You have your lipogel, tiny mechanical beads that exfoliate the skin. You have your activator, and then you have your carbon salicylic peel off mask. So essentially this will be your exfoliant before BioRePeel. Now the rule and tip that I have to give everyone is 1 physical or mechanical exfoliant before BioRePeel. So if I'm doing a dermaplane, I'm not doing a BioRePeel. If a Forever Kit. If I'm doing the Forever Kit, I'm not doing a microdermabrasion or a hydrofacial or a dermaplane. We're always gonna stick to 1 if needed, and then a BioRePeel treatment. Okay, we don't wanna overprocess that skin. Now, post BioRePeel, when BioRePeel is completely removed off the skin, you can do LED therapy, you can do a hydrating mask, you can do extractions. Really anything hydrating and rejuvenating can happen post peel. And this is great because you can really finish off that treatment, that facial, with something relaxing and soothing. Now, please make sure the peel is completely removed before going under an LED, before you put a mask on, before you put anything on the skin. When BioRePeel is on the surface, it should be the only thing on the surface. Nothing should overlap on top of it. Now, any questions on standalone treatment or mixing it in with dermaplaning, not microneedling just yet? No advanced protocols just yet.
Yes.
Standalone. I hear a voice.
There
Hi.
is a few, Mona.
Oh, hi, it's Alexia.
So someone had a question about her and her clients experienced a lot of acne after a BioRePeel. So if you just want to review the purging.
Yes, absolutely. And thank you for bringing that up. Purging is completely normal. How many times, well, I don't see anyone on the screen. You can do a little hand raise if this applies to you. How many times have we used a new ingredient like retinol, like AHAs, like BHAs on our skin and we had a little bit of a pop-up? I'm one of them. So when your skin is introduced, I see a little hand there, when your skin is introduced to new ingredients, purging can definitely happen. We are disrupting that, cell turnover process. This is completely normal. So if your clients do purge, this is normal. The key here is we tell them not to pick the skin, don't do anything. Maybe on their second treatment when they come back to you, or if it's a third treatment or a fourth treatment, you do a little bit of extractions. And that's okay with BioRePeel too. So that's why I say BioRePeel is so remarkable, is that you can actually customize the package based on the client's needs. Does this mean that every single client is going to purge once they do a BioRePeel treatment? The answer is no. Some clients will purge, and you will definitely know your purging clients versus the ones that aren't going to purge. So this is completely normal. So if you know a client has very sensitive skin, is acne prone, anytime they use a new ingredient, there is a little flare up. Please let that client know that you may experience some purging, you may experience some dryness, you may experience some flaking. Completely normal. But the beauty is that when they come back a week later to do another treatment, we're going to treat anything that popped up during that week. I hope that answered the question. Any other questions, Alexia or Benjamin or
Yes,
Maria?
there's just a few, but that was perfect. If maybe you want to just describe what makes BioRePeel different compared to other TCA chemical peels, specifically on like modulated TCA versus just straight TCA.
Yeah, absolutely. So with BioRePeel versus traditional TCA peel, a traditional TCA peel has one ingredient, and that's TCA. With BioRePeel, we have TCA, AHAs, PHAs, amino acids, vitamins, and gamma. What does that mean? That means BioRePeel is modulated. So it's not a straight acid that's going onto your skin. You're actually getting the benefit of other ingredients helping rejuvenate those skin cells at the same time. So that's what makes BioRePeel so unique and so special. It's the combination of ingredients and technology. So it's not just we dumped all the ingredients in this one vial and then now we're putting it on the skin. It doesn't really work like that. It's the technology behind it and the different layers on how they work within the skin. So with BioRePeel, yes, it's a TCA peel, so you're going to definitely benefit from a chemical injury, controlled chemical injury to the skin, but you're also going to benefit from all of the other ingredients that help rejuvenate those cells at the same time. When there's a straight TCA applied to the skin like your traditional chemical peels, it's just causing an injury. And then your skin has to go through that healing process. With BioRePeel, yes, we're going through that healing process, but we're getting help with other ingredients at the same time. Any other questions in regards to topical or standalone?
Yes.
Oh,
If you want to review the exfoliation. So, and you
yes.
mentioned how not to add another modality after the previous session.
I'm sorry, I'm not understanding how to add another modality after that previous session. One more time.
Did you say not to do an add-on modality after their previous session? So if you maybe need more clarification on the question, we can have that person repeat it.
Yes, please. I'm not understanding the question, but I will try and say that if you're doing BioRePeel, I said don't do multiple exfoliants before the chemical exfoliation, which is BioRePeel. So for example, don't do microdermabrasion and dermaplaning before BioRePeel at that same time. So you can do cleanse, dermaplane, and then BioRePeel, and then your post care. And then maybe in 2 weeks when the client returns, then you're gonna do maybe a cleanse, then a microdermabrasion, and then the peel. But we're never gonna do them at the same time. If that makes sense, and if that was your question, I hope I answered it correctly. Essentially, you don't want to overprocess the skin. There's so many different times you're going to see that client, and you can always switch it up. So there's no need to jam everything in that one treatment for the client. Sometimes we may think that's the best practice, but when it comes to BioRePeel, it's so powerful that doing minimal during that treatment really does give outstanding results. Any other questions? Can I go to advanced modalities? Yay, okay.
Yeah.
So BioRePeel, as everyone loves to pair it with microneedling, microchanneling, they love to spot treat with the gold. Again, I'm going to stress this. Please don't do this on treatment number 1, even treatment number 2. We really want to start slow and work our way up. Now, when it comes to microneedling and BioRePeel, it can definitely be done. We've seen great success stories and seen great pictures. Now, the most important, and I would, if someone can type it into the chat so everyone can see it, I will do it actually. 0.25 to 0.5 millimeters is the maximum depth you can go with BioRePeel as your glide. Okay, so 0.25 to 0.5. You're not going to go to a 1, you're not going to go to a 2. That is way too deep when it comes to BioRePeel as the glide. So if you choose to do a BioRePeel treatment and then microneedle right on top, you have to stay very superficial with your needling. This is great for someone that wants like collagen production, anyone that has scarring, if someone has a little bit of texture. This is definitely a great protocol and can be done. So what you're going to do is you're going to cleanse the skin like we normally did. At this point, you have to go in and sanitize the skin and degrease because we're taking needles to the skin. Once you have done that and you're ready, I wouldn't do like a dermaplane. I wouldn't mix anything else when the session is just with microneedling. We don't want to make the skin too sensitive. So what I like to do is just keep it very simple. We're going to draw up 2 ml like normal protocol. Now, the difference between a standalone treatment and a microneedling treatment is application. So standalone, we put this peel onto the skin and we massage it into the skin, correct? And then it gets sticky and tacky, and then we move to the next section. When you are microneedling the peel into the skin, you want this as your glide. So you're going to put it on the skin, you're going to quickly spread it left and right, and then you're going to needle right on top. When you're done that section, move to the next section. If you have to make your sections much smaller, please do so. The key here is that the peel should be placed onto the skin, spread so it's not dripping into the hairline, into the eyes, and then needle right on top. If it starts to get sticky and tacky on you as you're working, that means you're going to pull the skin. So add a little bit more peel on that area and begin to work that in. I generally like to say 1 pass, maybe 2 if you're dealing with complicated areas. But you don't need to do a 3rd pass, a 4th pass. That is too much for the skin when a chemical peel is your glide. When you're done that section, move to the next section. Place the peel, quickly spread left and right so it's not dripping, and needle right on top, or channel or stamp. The depth, 0.25. Please don't go any deeper than a 0.5. Next section, place the peel, quickly spread, and needle that right in. Once the entire section is complete, I would like that timer to be about 3 minutes to 5 minutes. That's it. And then you're going to completely remove with water, just like you topical. And then you're going to go in with post care and then SPF, and you're done. Any questions on microneedling? Yes, you can do nano needling, you can do channeling, you can do stamping, you can do microneedling. It all really depends on that depth. As long as your device has that 0.25 to 0.5 maximum, you can do BioRePeel with it. If your device has any heat, so no RF microneedling, you cannot do it with BioRePeel. So one modality that cannot be mixed with BioRePeel is thermal injuries, meaning lasers, RF, anything that releases heat to the skin, you cannot mix with BioRePeel, which is your chemical. So what is that's a great question. What does the healing process look like with microneedling protocol? So when you do any advanced treatment, so remember how we say your client can come back every 7 days to do a treatment? I always like to tell you, if you're doing an advanced protocol, meaning gold on the face, microneedling on the skin, Anything that requires more recovery time for the client, book their next appointment in 2 weeks. So if I'm doing microneedling, I'm not seeing the client the following week, I'm seeing them in 2 weeks to do another treatment. Okay, we want to give the skin a little bit more recovery. Now, because we're going very superficial with your microneedling, the recovery shouldn't be that much. So maybe there's a little bit more dryness, maybe they're a little bit more red post-treatment, but in terms of your traditional microneedling downtime is not going to happen with your superficial microneedling with BioRePeel. And that's why I always like to say, start off slow. So if I was your client, I came in today and I did a BioRePeel treatment. When I go home, when you follow up with me, I can tell you, well, that my skin feels like this is what I'm experiencing. And then the next week, when you see me, you can modify that treatment. But after one BioRePeel treatment, and if I tell you my skin is extremely sensitive, I had a lot of downtime, and it was painful for any reason, which should never happen, you know not to do microneedling with it. So that's why I always say, start slow and work your way up. Can you only do microneedling with BioRePeel Blue? Yes. On the face, microneedling should only be done with BioRePeel Blue. On the body, you can do BioRePeel Gold, but never, ever, ever put gold on the face and microneedle that in.
Mona, do you want to just review numbing?
Yes. So numbing with BioRePeel, it can be done, but honestly, we're doing such a superficial depth that it's not necessary. Now, I know I've had clients myself say, I cannot do anything, even if it's a 0.25, without the numbing. Sure, if you can go without it, please don't use it because it's not needed. But if you must, and it's mandatory, and it's a part of your protocol, cleanse the skin, numb the skin, follow your numbing cream instructions. Numbing cream has to be completely removed off the skin. Skin has to be sanitized, and then you can go in with your microneedling protocol.
Perfect, thank you.
You're welcome.
And we
Sorry,
do
I'm trying to read at the
have,
same time. So if that was an awkward pause, I apologize.
there's one question that's just wanting clarification on how long to spend microneedling with BioRePeel as the glide per section. They do mention like 3 to 5 minutes, or kind of just to get that area
Yeah.
done and move on. Oh, as
So
well
again, I will
as,
use sorry, Alexia.
just as well as what happens when it gets tacky.
Okay, yes. So when you're doing microneedling, you want to do one pass. If one pass on the forehead takes you 10 minutes, please work faster. That is too much time with BioRePeel being on the skin for 10 minutes. For example, let's say it takes you 10 minutes to do BioRePeel. I don't want this to get too complicated because then it's going to get a little confusing. Please reach out to your rep and they will explain it to you. But just to go over it very fast, if it's taking you 10 minutes to do the peel and microneedling, remove it and then move to the next section. I don't want this section to stay on until the entire area is done. That could be 30 minutes. That's too much. Even though it's a self-neutralizing peel, you've created open channels, you're doing a chemical injury, mechanical injury, it can get too messy too fast. So what I like to say, BioRePeel, if you have to make your sections much smaller to do a fast needling, please do so. Place the peel, quickly do one pass of needling, move to the next section. Place the peel, quickly do your microneedling, move to the next section and repeat. If during your microneedling you feel like it's getting sticky and tacky, just add a little bit more on top. That's all you need. Essentially, that's why I say work fast, it's because it's going to get sticky and tacky. If you're taking 10 minutes to do it, it's going to get very sticky and tacky and your client's going to be super uncomfortable. Now, we do have a portal. We do have all of this written down. Don't feel like you have to memorize this right now. Everything is written for you. Your reps are always going to be there for you. Call us, text us, email us at any point. When it comes to advanced modalities, we really would rather you ask 1,000 questions when it comes to it than just do it on your own and then send us pictures of SOS, okay? After you're done the whole face of microneedling, that's your timer is for 3 to 5 minutes, and then you remove with water.
Perfect.
Okay.
And then I think that covered with we did have someone mention intimate area, what's the protocol? The protocol will remain the same for a standalone treatment, but I would assume, how would that be with microneedling?
I wouldn't do microneedling with intimate area. Okay, so intimate area, BioRePeel Blue is what you're going to use, and the application remains the same. Place it, massage it in until it's sticky and tacky, set a timer, remove with water. I'm just
Perfect.
gonna grab a quick water if someone else.
Course.
Yeah.
And then do you want to just go over how far apart in between peeling sessions with the microneedling can you do?
Yes, so remember when you do microneedling, you're always gonna follow your microneedling rules, which is 4 to 6 weeks in between microneedling sessions. This doesn't mean BioRePeel you can do every week, we're gonna do microneedling every week. No, we're gonna keep it the same. So whatever you were trained with, it was 4 to 6 weeks in between microneedling, that's what we're gonna stick to. So within that 4 sessions, you see your clients, maybe one of them is a microneedling. You're not gonna do microneedling every single week or every single 2 weeks. That's too much, too aggressive, not needed. So everything with your microneedling, your technique, the depth we already know is 0.25, and the time in between microneedling treatments is all gonna remain the same. The only difference is that BioRePeel is your Clyde. Sorry, Benjamin, were you gonna say something?
No. You're right on point. I just want to be cognizant of time. Listen, the
Yes.
response has been fantastic. I think we can do a completely separate discussion on Lucente and seromesotherapy. Everyone, they are essentially game changers. You don't necessarily know about them. We will discuss, the ins and outs of them. They are a completely separate line, completely separate from BioRePeel, but they are used together. They are used to be paired together. Um, Mona, you killed it. Ladies and gents, please, if anything, the takeaway here, low and slow. Do not go fast. You go into a dealership, you buy a brand new car, you don't rip out of the dealership doing 200 miles an hour. You have a new personal trainer at the gym, they're going to go low and slow with you. Same thing with your customers. Get good with topical applications. Get the best results you possibly can, and then you can start talking to your reps about how to incorporate some of these other treatments that you either see on TikTok or Instagram, okay? There is a lot you can do with these peels. There are tons of applications, but just because you can doesn't necessarily mean you should. Always assess the skin properly. Manage your customers' expectations. Okay. All I constantly see online, oh, we got an echo now. Online and essentially through TikTok, okay, are these incredible results. Ladies and gents, what you do not see is everything that goes into that, the consultation, the diagnosis of the skin, how long it took them to get there. Okay. Everybody wants great results. It takes time. Please take your time, be patient, get good with topical applications, understand how these peels work, what they do. And if you have any blanks that you need filled in, our reps, the people that work at Bioskin Aesthetics, are all schooled on this stuff. They will help you. So whoever your rep is, please don't be shy. Reach out to them. Ask questions. If you're unsure, do not proceed. Ask questions. If you're getting the same results after 3 treatments and you're not happy with it, stop. Do not keep going. Ask your rep. Talk to your resources. Find out what's going on. We work for the company, Bioskin Aesthetics, the distributor. We have all the information that you need. If you're in a bind and you need help, we are there for you. Please reach out to us, okay? Maria, feel free to share our information. We are all happy to help you guys, okay?
Thank you so much, Ben. And there are, some questions here
Yes,
about
Mona.
results. Sorry, Alexia, one moment, please. There are some questions about results, and as Benjamin mentioned, the results are there. What takes to get to those results are unknown, because a lot of people don't like to share their recipes, and I'll be the first to tell you, sometimes you're going to see results after your first treatment, that lifting, that brightening, that glow. Sometimes you're going to see results after that first series, after 4 treatments every 7 days or every 2 weeks apart. Sometimes you're going to see results after 3 series. It really depends on the 360 approach. If you're treating melasma or pigmentation and you're, doing everything right in the clinic, but your client goes and bakes outside underneath the sun, you're not going to see any treatments. And that's not because of BioRePeel. That's because, melasma, pigmentation, love that heat, love that sun, and it's just going to display on our skin, right? If someone is not, eating clean, taking the right care of their skin, as little as changing pillowcases, the acne may still remain there. So it's really important to really get to know your clients, understand what's happening at home, what products are they using, what does their diet look like, what do they want to see with their skin, and really base that around the treatment plan that you're going to provide for the client. If the client says they love the sun, they love to be on their boat, and they don't wear sunscreen, maybe just do rejuvenating treatments, right? But to treat that melasma and that pigmentation for someone that really loves hot yogas, hot showers, outdoor swimming, you're really not going to see that much improvement. So we really say, please have open conversation with clients. There are consent forms. You really, really, really need to have these consent forms signed, take before and after pictures, progress pictures throughout. We do have a portal. Once you sign up, you will get access to our portal. The portal has all the information you need. It has videos, pictures, consent forms, written procedures, protocols. It's all there. One thing I didn't mention, I think it's extremely important to mention, is contraindications with BioRePeel. Pregnancy, nursing, do not do a BioRePeel treatment. If anyone has any allergies to any of our ingredients, don't do a BioRePeel treatment. If anyone has been on Accutane, antibiotics for acne control, please get doctor's consent first before you do a BioRePeel treatment. Actives, retinols, anything that's topically applied to their skin throughout the week needs to be paused a minimum of 7 days prior to doing the peel. Sorry, I just have to mute you, Alexia. If you, let's say your clients are using active ingredients throughout the week, they need to be paused before you do a BioRePeel treatment, minimum of 7 days prior, okay? Again, there's a whole list of our contraindications. You can see all of those. The main one is allergies, nursing and pregnancy, antibiotics, get doctor's clearance first, and any active ingredients that they use throughout their skincare routine throughout the week, cleansers, topicals, night creams, eye creams, any of that stuff has to be paused before a BioRePeel treatment. Continue off of it until your last treatment is complete, and then you can go back on it. I think that's about it. Maria, are you there?
I'm right here.
Oh, perfect. So is there anything that you want us to discuss? Anything in the comments that needs to be addressed?
Do we degrease the intimate area with alcohol or just gentle cleanser?
I personally like to do a degrease only because, we're wearing clothing on top. There is, sometimes sweating can happen. So I always like to go to alcohol on the entire body. It's just face. I always like to say, don't use alcohol. There's other alternatives. On the body, always use alcohol under the arms, the intimate area, legs, hands.
I also did share a picture in here about Lucente, which I think we could do a whole different one on Lucente that is amazing for melasma. And then no radio frequency. We talked about the gold on how to spot treat, which is something I really wanted to dive into.
Yes, spot treating. Sorry, I didn't go over spot treating, but it's very easy. When you're using spot treatment on the face, maximum time is 3 minutes. So application of blue remains the same. Areas that you want a little bit more TCA, go in with the gold. Timer 3 minutes and then remove. Application's the same, place, massage it in. You're never going to do gold all over. That's not going to happen with my gold. Gold is only for spot treatment. So let's say I have pigmentation here. You can spot treat gold here for 3 minutes and then remove.
And you are going to have lifting, frosting. Yeah.
Frosting can definitely happen with the gold. It can also happen with the blue. It's superficial frosting. It's not going to be a full face blanch. This is normal. There are different ingredients going on. Sometimes the skin barrier is compromised. Frosting will happen. Sometimes there's high protein levels in the skin. It can happen. But if frosting happens throughout your treatment, just take a 4x4 that's wet with water and dab. Remove the frosting, let the peel sit. Timer is up, completely remove everything. Anywhere that frost generally is going to have a little bit of flaking and dryness, so you have to encourage relift and rehydrate daily, sometimes 3 times a day, just to keep that skin hydrated. The only homework for client is hydration, 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 and that is with my relift and rehydrate. These are the back bar sizes. This is the retail size. I just don't have the other one. Oh, it's right here. These are what you're going to send home with the client, and this is what they're going to use.
And
Morning and evening.
And our handy dancing cleanser now.
Oh yes, cleanser. I have it here. If it's not in my bathroom, it is in my bathroom. I'm sorry, I use it. But yes, the cleanser is for back bar. We don't send the cleanser home with the client, but gentle cleanser.
Do you mind giving a 10-second elevator pitch on Lucente? Because somebody asked.
Yeah, absolutely. Lucente is amazing. And essentially what it is, it's a depigmenting program. It does not have any bleaching agent in it. It really has ingredients to tackle all 4 stages of your melanin production. It has your tranexamic acid, your arbutin, your glabridin, your aminosylphosphinic acid, some powerful ingredients that not only stop the melanocyte production, but also push down and manage anything that's on the skin. It is the only thing on the market right now that will do that. It does come in a program. So you are going to have a 3-month all the way to a 6-month program, depending on that severity of that pigmentation. But then you also are going to be sent home with a home care cream that the client will use. This is like a whole other topic that we can spend a whole hour talking about. But essentially, if your client's main concern is pigmentation and melasma on their skin, I would put them on the Lucente program. Yes, BioRePeel is great. BioRePeel will brighten that area, but Lucente will get rid of it. Anything else, Ben, you want to add on to that?
I mean, no, you nailed it. Listen, the 4 very important things that Lucente does, as Mona said, is it helps regulate the production of melanin. Okay? Say it again. It helps your body regulate the production of melanin. This is important. Lasers don't do that. Okay? It's either that or you're into another commonly used product out there. We won't mention it. We don't talk about it. But at the same time, you want to help your customers see some change. Okay. This comes back to making sure you have a good candidate for this particular application. This is a program. If your customer or your patient isn't willing to commit to the program, it's not for them. Okay. Very important to understand. So the 4 things that it does helps regulate melanin production. It is also going to disrupt the formation of melasma. It's also going to inhibit the transfer from cell to cell. That's a big deal because what happens when melasma gets upset and wants to spread, it wants to spread wide, it wants to spread deep. And then thirdly, through the use of a home cream, we're gently lifting all of that melanin to the surface of the skin to be exfoliated, okay? We need a whole other discussion about this because we can get into the nitty-gritty, the applications, how it's going to be used. The program is very simple, but at the same time, if you don't have a good visualization of what you're doing with your customer, how do you ever hope to offer this as a service, okay? Again, full support, full training is included with every single product. I think, Maria, if it's cool with you, Mona, if it's cool with you, Alexia, if it's cool with you, we should definitely table this discussion, maybe answer a couple more questions, and then have a second session specifically focused on serum mesotherapy, because that for me is a game changer, and Lucente, which is a game changer for the entirety of the country.
Absolutely, yes, I'm on board. There is one thing that I would like to mention. Can BioRePeel be used in conjunction with Lucente? I always like to say finish your series of BioRePeel and then start them off on the Lucente program, or do the Lucente program and then go to BioRePeel. With Lucente, it's really important just to stick to the program. Don't mix and match any other modalities with it. Although BioRePeel can be paired, and there is a whole other section on how to do this, I always like to say do them separate because you'll benefit from BioRePeel and then you'll benefit from Lucente, and the client will just have magnificent skin. So to answer that, you can, but we'll keep them separate, if that makes sense. Maria?
So there is going to be a replay. 2 things. You guys can either subscribe to the newsletter, or if you click right here, you can subscribe, or it would also be uploaded to our YouTube. So it's YouTube, newsletter, whatever one you guys want. And the YouTube is public, so everybody can go to it. And then 2, I want to make sure that you guys have Mona and Ben's email address, which I had right here. Scroll right here.
Yeah, reach out to us. If you are looking to add BioRePeel onto your menu, please do pick our brain. We're always here to support you. It's the perfect time to add BioRePeel to your menu. It is peel season, although BioRePeel is safe all year round. This is the perfect opportunity to get your clients hooked onto BioRePeel and continue on those treatments throughout the summer. Because there is some hesitation with new clients, having that stigma of like, chemical peels should only be done in the winter time. And then when you're trying to introduce it in the summer, it could be more challenging. But this right now during peel season is the perfect opportunity to put BioRePeel on your menu and really get out there to take those before and after pictures so that you can offer it 12 months out of the year.
We have 2 quick questions. How far apart for a standalone? And then the second question is Lucente a lotion or a peel?
So first question was BioRePeel. You're going to do every 7 days apart if it's by itself. You're going to do every 2 weeks if it's advanced, so microneedling or spot treating with the gold. The more advanced the treatment is, the longer repair you're going to have in between treatments. Second question, Lucente is not a peel. Lucente is a system, and it has different ingredients in it. It generally is going to be microneedled into the skin. It is a serum. It's a mesotherapy serum with a take-home cream that they're going to use morning and evening. So it's not a peel. BioRePeel is the only chemical peel. Serum mesotherapy is rejuvenating ingredients, and Lucenta is a whole depigmenting program that is with a cream and a serum. Good?
Does anybody have any more questions? So it will get sent out. I'll also put the YouTube channel inside of the BioRePeel group, and then I'll send it to David and Mona, Ben and Mona as well. And please screenshot their emails. We'll have a second for you guys to screenshot them. And I will also add their emails in the newsletter.
Awesome. Well, thank you all so much. Honestly, thank you, Maria, for this opportunity. It was a pleasure meeting everyone. I'm so excited to connect with you all, to see your incredible before and after pictures. So please, we're always here for you. Reach out to one of us if you have any questions, if you need help, navigating through our portal, navigating through our entire product line. We are always here for you. And I'm going to pass the mic over to Ben.
He said about spot treating with gold. Do you apply the blue everywhere first, then spot treat with gold, or do you apply gold and then after?
Okay, so when you're doing spot treating with gold, never on first treatment, but how it works, there's two ways. You can do blue all over, skip the areas you're gonna go in with gold, and then set your timer. When your timer reaches around 4 minutes, you can apply gold. And when your timer is up at 7 minutes, everything comes off. Gold sat for 3, blue sat for 7. If that's too much, you can do blue all over, skip areas with gold, set your timer, remove blue, and then go in with the gold and set a timer for 3 minutes. Okay.
All right. Thank
Awesome.
you guys. And I'll
Thank
have
you
it up
guys.
in like the next hour.
Thank you, everyone. Have a wonderful night, and we will see you all soon.
Bye.
Take care.
Absolutely. Take care. Bye.
Bye.